You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, new treatment options for people suffering with TMJ problems. And with us, we have an expert on this topic. In fact, he's a go-to person throughout the United States for people that have TMJ problems or disorder. With us, we've had him on the program before. He's also known as a go-to person in Beverly Hills for cosmetic dentistry. With us, we have Dr. David Frey. Dr. Frey, welcome to the program.
Thank you for having me. It's a pleasure.
Okay, good. You know, we always have to beg you to come down from LA to come to our studio. So thanks for coming in again. Now, you brought a ton of photos. So we're going to try to get to as many of those as possible. But for people that don't know your practice, like who's the typical patient you see, both with the TMJ problems and then the cosmetic dentistry?
Yeah, the typical patient for me, Randy, is anyone who's really unhappy with their smile, someone who has a problem parting their lips, and really exuding their own confidence in their own life. I also have a great set of patients that are suffering from headaches, neck pain, jaw pain, facial pain. We call them TMD patients or TMJ patients. And they sort of go together with the cosmetic patients because of, we say form follows function.
Hey, what does that mean?
It means that, you know, if your smile's not good, it could be that there's something wrong, that the bite's not right or something's not level, things are not in the correct position. And by getting them in the correct position, you actually look prettier. So that's why function is so important if you want to get a phenomenal smile. It's not just about making teeth beautiful by themselves. You have to look at the underlying reason why they're not beautiful in the first place.
Okay, now you're training, and people need to know, look, I'm not trying to side with you today, even though I've met a couple of your patients over the years. I think you brought them here to the studio.
Correct.
But you've had a lot of training in this, and you went to this Las Vegas Institute. Tell me about that.
Well, the Las Vegas...
You say if you're going to go get a TMJ treatment, you got to go to a dentist that's been to this LVI.
Correct. Well, I love the Las Vegas Institute for several reasons. One, it's got an impeccable reputation. It's sort of like the Harvard for postgraduate studies in dentistry.
Okay.
The Juilliard of music. They make beautiful dentistry at this institute.
So dentists from all over the world, is that true? They
Correct.
go there?
Correct. Dentists from all over the world filter in there. It's tough to get in. I'm privileged and blessed to be a part of their institute and to learn from them. In regards to cosmetic dentistry, I have to tell you, Randy, it's the most phenomenal technology. I can't believe how well it works. I've been doing it for 30 years.
Okay.
Veneers have been my passion, bonding porcelain veneers across people's smile. They rarely, highly unlikely, that they ever break, chip, or fall off. It's incredible.
So if the teeth don't come together right, those veneers may pop off.
Yeah, so that's why if I ever have a problem with a patient with a veneer chipping or cracking, I say to myself, did I have control over that bite, or did I restore that tooth in its normal habitual bite position? And usually it's their old bite position if they're going to chip or break. Once a patient gives me control of the entire masterpiece, like I have the whole canvas, I can make sure that the function and the way it all comes together is physiologically correct. And the chances of anything chipping, breaking, falling off is highly, highly unlikely.
So moving on to today's topic, the TMJ disorder. Are there a lot of people with TMJ problems, like causing migraines, neck pain, things like that?
Well, Randy, I've been on your show for, almost a decade now. And I always wanted to do a TMD show. I wanted to come in and talk to you about people with TMJ problems, meaning headaches, neck pain. And you've always been a little resistant to that. And I've
always felt like it's not really a big deal. Like there's not a lot of people with it, is what I'm saying.
Oh my God.
And I'm wrong, apparently.
Yeah, totally wrong. I mean, the phone, the response has been insane. There are so many people suffering from chronic headaches, neck pain, facial pain, clicking, popping, cracking in their joints, ear pain, tinnitus, ringing in the ears, dizziness, all sorts of head pain and neck pain that people are living with constantly. They don't need to be, and they live with it every day. And so glad that we put it on your show, and the response has been overwhelming.
But you see reversals, like people, because I saw one of the videos, a woman said she had like balance issues, migraines, gone. Is that typical?
Yeah, that's what we do every day. So we're very careful. We do a lot of diagnostics. We take a full head CT. A full head CT is like a 3D X-ray inside your whole head. You know what I can see? I can see your airway, how you're breathing. I can see your neck posture, how the vertebrae are lying up next to the neck. I could see the jaw joint, if they're smashed or spushed or eroded. I could see the sinuses, if they're clear. I mean, I have patients come to see me for TMJ problems. Once I take that X-ray, I find out they don't have TMJ. They have something else.
Okay.
So we do a very careful diagnosis to make sure that this is what the problem is.
And you also put like electrodes on their muscles. It's like like physical therapy in a way.
Well, listen, I'm a doctor,
okay,
and doctors like to have scientific instrumentation. What we're using is called EMGs, electromyography,
okay,
and what they are like a Richter scale showing an earthquake. So when we put these sensors on your muscles, if we see the Richter scale going like this,
what does that mean?
High activity, the muscles are not happy. When we see it really low, the muscles are calm. We have a nice patient.
What do you mean not happy? Like they're tensed up?
They're tensed up and they're firing.
Interesting. You can see that on a machine.
That's right. So we see that, and our goal is to get everything calm. And so it's not just like, here you go, this should make your muscles calm. I'm actually testing it as a doctor, evaluating the information and assessing, making sure I've got my positioning right. Because what we look for is a sweet spot. I call it harmony. Harmony between the jaw joint, the muscles of the head and neck, and the bite. The teeth should come together where the muscles are relaxed and the jaw's in a good position. I try to find that sweet spot. I actually work in the opposite direction. We first relax muscles and we try to get the jaw to decompress, to open up a little bit. And once we do that, we see where the teeth are, and then we make a bite into that position where the muscles are relaxed.
And their symptoms go away.
They diminish greatly. They go away on a lot of patients, and they diminish greatly on a lot of patients. And some people take more time than others to get healthy, but they know they're going down the right track, and they know they're getting progress each day as it goes. I just had a patient tell me, Dr. Frey, I looked in my medicine cabinet, and it reminded me of all the drugs and all the medication that I had to take to relieve myself from these headaches that doctors were prescribing her. She hasn't had to take any medication whatsoever. I'm anti-medication. I'm anti-surgery. I want to do things in a physiologic way to help patients' bodies heal themselves. Our bodies are made to heal themselves. We can recover on our own.
Help me understand this. How does the way your teeth come together, what's the connection? How do you get a bad headache from that?
Because those teeth are holding a position that could be uncomfortable for your muscles of your head and neck. So there's a huge fan muscle that goes around the side of our head. It's where people get migraines. They're always right here. If that muscle is hypertensed, not happy, really firing a lot, and just by moving the jaw position to a place where this muscle can now relax and holding it there, it works instantaneously. The body just, oh my God, you found relief for me.
Now you've said you've had people, even on the console, like you make a temporary little splint or something, and they already feel relief.
Correct.
That happens? True. That's rare, very rare?
No, it's not rare at all. In fact, I'm surprised when it doesn't happen. So that's why we try to do really good diagnosis beforehand to see how well we're going to help this patient, how many issues are there. But typically, as soon as we put these orthotics in people's mouths, they get immediate relief.
Okay.
And so we call it an orthotic, but what it is like a fake bite. It's a trial bite. It's a bite that we place over, we resurface your own bite into that position where the muscles are happy and the jaw's in a sweet spot. So it's sort of that harmony position. That's where our orthotics are made. You know, the typical dentist, when you go to a dentist, they'll just give you a splint. They'll just, here's a piece of plastic, put this in your mouth and see if it helps you.
And it does help sometimes, right?
It does help sometimes because there's a zone of adaptability, but we're using such exact science. We're doing such good instrumentation to find that right exact position that it's hard for us to miss.
Okay.
So that's why when we make a splint or an orthotic fake bite for someone to hold their muscles in that relaxed place, we win a lot of the time.
So, and we've talked in the green room that how TMJ is treated by most dentists is a little different than the Las Vegas Institute trained, this LVI trained doctor. So tell me how it's traditionally done and how you're doing it.
Well, traditionally, a dentist will give a patient a mouth guard.
Okay.
And that mouth guard a lot of times can help a patient. But we want to make sure that the position of that mouth guard is in this harmonious position with the muscles in the jaw joint. So we're using CT diagnosis and the 3D X-ray, and we really zone in on this position. The jaw can float like a boat in water or an airplane in the air. It can roll around like this. So if you just put a piece of plastic between your teeth, most times you're going to lose. You're not going to help.
It'll just be temporary relief.
Yeah, I mean, I can tell you that I have so many patients walking in my door with a bag of splints that they got from previous dentists that never worked, but mine seems to work. And it's because we're using instrumentation to help guide us into this position.
Okay.
But I want to let you know that I don't end at that position. That is what we call the beginning phase. We call it phase 1.
Okay.
And that's just to help you, just to make sure that we can cure you, that we can stop the headaches, that we could stop the neck pain. You can go and play with your children again. You could be a mom again. You can go to the office and work and do your job without being interrupted and without
because
popping.
You have a headache.
Yeah, because you have a headache or neck pain. You don't have to pop a million Advil. We can get that life back for you in phase 1, but that's not a permanent cure. I know the word cure is a dangerous word. It's a hot topic word, but we're actually curing patients. It's really phenomenal. And as we cure it in phase 2, in the second phase.
Okay.
And the way we do that is I look at a splint that a dentist gives you as a pair of crutches. Here's a pair of crutches. Wear this for your bad knee for the rest of your life. And so do I ever take it off? No, you can never take your crutches off. Can you imagine? So that's what a splint's like. It's like giving someone a pair of crutches forever. So what we do is we want to put your teeth into the position of the splint. The splint's been helping you. This little fake bite has been relieving all your headaches and keeping your neck relaxed. And we want to move the teeth into that position.
So you don't have to eventually wear a splint?
Correct.
Okay.
So exactly. So there's 2 ways to do it. We either do it with crowns and veneers, and that's what I did on my teeth. I just moved my teeth. Good. Yeah, I just moved my teeth into the position of the splint.
Okay.
Or we can do orthodontics, but we do a very special type of orthodontics.
Yeah, you call it physiologic orthodontics.
Correct. We do it because that's a place where your muscles are all relaxed. It's a place where your airway is not smushed, but we open up your airway so you can breathe better. It's a place where your neck and posture, where your head weighs 10 pounds like a bowling ball, sits nicely over your head and your body. So your ears are lined up with your shoulders. And we're actually respectful to the rest of the body, where a lot of traditional orthodontics is just making straight teeth. And straight teeth doesn't mean good jaw development. So if your jaws are smushed back in your head, they're going to cause a lot of pain back there. They could cause the ringing in the ear,
so
the
let me
vertigo.
get this straight. And not to be mean to any old school orthodontist, but there's a predetermined bite that they've established, right? That they're going to bring everybody into this bite position.
Correct.
Whereas you, I want to make sure I'm getting this, because I think I've interviewed so many times, I'm finally getting it possibly, that what you're doing is you're customizing their bite based on their muscles, their physiology.
Correct. But yeah.
Is that it? Do I kind of have it?
You have that down perfectly. And we go one step further. We look at see the relationships of the 2 jaws and where they are underneath your cranium. And if they're smushed back or not, we have ways of bringing them forward and relieving what we call functional space. The body loves space. There's so many muscles and nerves and little anatomic structures that are running behind your nose and your upper jaw that they're getting squished back there and they're causing pain. And by creating more functional space, the body loves it. It relieves itself of these problems.
You say traditional ortho is retractive, and yours is different.
Ours is protractive. We are moving all the teeth out from under the cranium. We're moving them forward this way, and it's a more attractive look.
Now you have a photo right there of a V versus a U bite.
Correct.
And for people just tuning in, we're talking about no more migraines, no more neck pain, that your migraines may be connected the way your teeth come together. With us, we have, LA's hottest TMJ treatment guy, Dr. Frey. So go ahead. So we're looking at what here?
Yeah, so this is what I would call a V-shaped arch versus a U-shaped arch.
Okay.
And if you look at our caveman ancestors, they had really broad arches. They had nice big airways that would roll through that they can breathe through. And today, with orthodontics and the way it's a Western culture, our food's a little too soft, and maybe our diet has changed a little bit.
They're becoming more narrow.
They're becoming more narrow, and it's compressing the airway, and there's a lot of sleep apnea. People can't breathe at night. It's really a tough thing.
So you're just opening it up.
Yeah, we're reversing it. So we say people are born with a DNA potential, and the environment, when they're growing up, something corrupts their DNA potential where they don't actually get what the DNA was meant to give. And so there's ways for us to calculate where the DNA should have been, and we actually go to that position for the patient.
And then their migraines go away?
Their migraines,
or their chronic headaches
oh
lessen?
my God, yeah. Well, the thing is, form equals function or follows function. We always say that. So if you want to look beautiful, you want to look your best, you have to feel your best, and you have to work well. And so when things are working well, you're going to be prettier, and it opens up your whole face, and it's really incredible the results that we get, because I'm not a plastic surgeon, but I'm actually helping people get a more defined chin.
Like you say, somebody with a weak chin.
Correct.
Instead of a chin implant, they could bring their jaw forward with this physiologic ortho.
Yeah, let me show you.
You've actually had a plastic surgeon go to you.
Yeah, look at this picture, Randy.
Okay.
Look at his chin. I looked up chin implant on television, and I'm telling you, this looks just like he had a chin implant, but he didn't. He just had corrective physiologic orthodontics. I want to show you this one look at this patient and look at her cheeks before. I want to show you that it's very, very flat.
Okay.
It's coming down from her eye. It should be parallel with the nose, the cheekbone, and it should be parallel with the nose. Look at this result that we got afterwards. Now, this girl, she was in a restaurant in London, and she, all of a sudden, she realized she has cheekbones. And she's sitting there with her camera, and she's just taking pictures and selfies of herself, because this is the first time that she's actually noticed her face is changing a little bit.
So just because you brought her teeth out a little bit more and it changed that profile?
Correct. We actually moved the whole jaws, so the upper jawbone came out forward using this appliance that we use. It's like an orthodontic appliance.
Did she have also symptoms that went along with this issue?
Oh yeah, she had very bad TMJ. She had headaches, neck pain, and she sought me out to help her with all of that. Once I helped her, and we talked about, now let's put your teeth in this position, she went ahead and listened to me, and we did exactly.
So her migraine problems went away.
Correct.
And then the side effect was it changed her face.
Correct.
Did you know that was going to happen, or had a feeling this was going to happen?
Well, that's what makes my job so beautiful, is that every patient is challenging. It's unpredictable. You never know what you're going to get with every patient, and that's what makes it fun for me. That's why I love helping people and love getting an optimum result for patients.
And for her, the headaches go away.
Headaches go away. Pain goes away in the ear, ringing in the ear, vertigo.
Ringing in the ear? There's a connection to the way the teeth come together?
Oh, absolutely, because there's so many nerves. There's a nerve and a ligament that is shared between the jaw joint and the ear. It's called the DML. It's a type of ligament that just goes right from there to there. If it's tight, if it's compressed, it's going to put pressure on the eardrum.
So you've had people with ringing ears, and this treatment took it away?
Absolutely, 100%.
Wow. Is that common, by the way, out there? I don't know anything about ringing of the ears.
Oh my God, ringing the ears! You wouldn't believe how many patients are suffering from that.
You're laughing because you can fix it.
Yeah, we can fix it, but I can't guarantee anything. I'm not a salesman. I'm a doctor.
Okay.
And we go one step at a time. We do all our work very systematically, and we see what the result would be. I want to tell you about this patient, Robin.
Okay.
Now, generally I treat patients with TMJ problems, but she came to me just because she wanted to look more beautiful.
Okay.
And so I'm very hesitant to work on anyone that just wants to look more beautiful.
Because she wanted better teeth. Better looking teeth.
No, she wanted just her facial profile to be more enhanced. And she found out that this device that we use in our office can make jaws more pronounced and make cheekbones more pronounced and lips come alive on patients' faces without plastic surgery. No scalpel, no nothing, just by your own body's physiology.
So with her upper teeth, they're kind of pushed, they appear to be pushed out.
Yeah, but that's just temporary. You wouldn't believe how fast that goes back to normal. Because what happens is the lower jaw comes out to meet it. You could bring your lower jaw almost anywhere. You could set your lower jaw out. So if the upper jaw is like a cage, got really big, the body likes it. The lower jaw likes to follow it out. So just look at that space. Now look what it did for her lips, Randy.
Her profile.
Yeah, look at her profile. Look at those. If you look at her lips up against her nose where her nostrils, it's a lot more forward. And with that big space there, look at how it enhanced her face. And that's all without plastic surgery. That's done organically using your own body's physiology. No scalpel, no stitching, no downtime. But yes, she is going to need some braces and some orthodontics, but it only takes about a year to do it all, and it's really not a big deal for a lot of patients who really want to go through that. Randy, look at this person. This is Tracy. So Tracy came to me and she told me that she was suffering from headaches and some neck pain, and she was just having some issues getting out of bed. And we see patients like this all the time with teeth like this, and what we did was we went ahead and we found her corrective bite position, and her headaches went away and her neck pain went away. And as a phase 2 option, as a
phase 2 means the part about making the smile look good.
Correct. So yeah, to keep it permanent, we made her a new smile. We put porcelain veneers over her smile, and look at that. Boom, she's beautiful.
Very nice.
And she doesn't have those headaches anymore.
Have you ever done veneers on somebody that they didn't come to you for migraines, they didn't come to you for their TMJ problem, but the side effect, not only do they get a beautiful smile, but then they're saying, hey doc, do you know that my migraines went away? Like you didn't even know they had migraines?
Yeah. So
does that ever happen?
It happens all the time. In fact, this patient, John, he told me that he came to me for nice teeth, but he didn't realize that he had TMJ. And once we put all his teeth together and made him beautiful teeth, he says, this click and pop that's been in my jaw for so long, it doesn't happen anymore. I can open and close my jaw freely. And that's amazing. I didn't know that I was even going to get corrected that way.
So if you have popping and clicking in your jaw, are you headed for like some problems in the future? Usually?
It's a sign that there's lack of harmony between the muscles of the head and neck, the jaw joint, and the bite. So if you're grinding your teeth, if you're like, clenching all the time.
Now you say people with their teeth grinding don't even know they're grinding. And what's the big harm in grinding?
Because a lot of people grind their teeth while they're sleeping at night. So they wake up in the morning, their jaws are completely sore, and they don't even know why they're so sore, but they're just clenching and holding on so hard.
Because the body's trying to find a comfortable position?
Yeah, and it actually goes the wrong direction. Because by grinding, it's making your dimension of your teeth go down more and more.
Because you wear them down.
Yeah, so you look more like, an old person's jaw as it comes down. Where the corrective position would be to open up, to build it. That's why we reline the bite and we resurface it to that harmonious position. And that's how we find that corrective position for patients. You were mentioning to me in the green room that a lot of patients, they come in and they put fillers in their lips, and then their lip drops down and they can't even see their teeth anymore. Well, this wasn't her, but this is showing you the result of what you do when you correct a bite position into the proper position. All of a sudden she gets teeth. It's like she had no teeth before, Randy. She couldn't smile and show any teeth. All of a sudden I gave her a body part that she didn't have just by
So that's not just the angle of the camera. I mean, literally you built out the teeth.
That's right.
And now it shows.
Oh my God. And she came to me for TMJ too, and she's a fantastic person. So I'm glad I was able to help her.
Now the patients you say will actually say, Dr. Frey, you've changed my life. Is that right?
Yeah, and that's what, when they say I changed their life, just in the beginning, at phase 1, when we put the orthotic in and we find that balance, that sweet spot. But what's really going to be life-changing for these patients is when we move them into phase 2, where we actually develop the jaws, bring them forward, bring the teeth forward, get everything balanced, and make it permanent. Because,
make it look good.
Make it look good. Because form and function, art and science, they roll together. You can't take them apart. Let me tell you, if you looked at Hercules, you wouldn't say, he has a breathing problem, he has a bad bite, he can't, he's snoring at night. No way. He's so beautiful that he's functioning. So like, they work together. You can tell by looking at your patients right when they give you their eyes if they're working well or not.
All right. Look, we are out of time. Let's say somebody's watching this. Final message. Somebody watching this, maybe they have chronic headaches, at least maybe 10 times a month. Affects their job, how they feel with their kids. Or they have the obvious symptoms of they wake up with a sore jaw or popping and clicking. And they're hearing what you have to say. What's your message to them? But for whatever reason, they're skeptical. They're going, I don't know. What do you say?
I say, you have a long life ahead of you, and it's about the quality of life on the journey. You want to have a good quality of life, get rid of this pain. You don't have to live with it. You don't need to live with headaches. You don't have to have constant neck soreness. You don't be grinding your teeth, jaw popping, vertigo, dizziness. It doesn't have to be. You could come in and we could make you a beautiful splint, like just an orthotic, that we could put in and eliminate it just in this first phase and see if that helps you or not. And if it does, then let me take you all the way and go.
So somebody has a TMJ problem, migraine problem. They should at least go in, you hook them up, and you'll let them know whether, is it fast? Like you say, I think I can help you.
Yeah, we call it a 5-minute exam. 5-minute exam is we put these sensors on your muscles and we just run a few tests and we could see if you are healthy or not. If you have a pathologic bite, like a diseased bite, or you have a healthy bite or not. But that coupled with a CT scan, a 3D X-ray, I can really see it all.
Okay, good. All right. Well, I want to thank you for coming on the program. Always a pleasure.
Thanks for having me, Randy.
If somebody wants to make an appointment, do they still get to see you? Because I know you have a big center over there.
Yeah, I take pride in my practice, and I treat all my patients myself. And even though I have a big name, I have a very boutique type style office. I really spend a lot of time with each individual patient, make sure they get the help they need.
All right. I want to thank you for coming on the program.
My pleasure.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.